All right, let's talk about sepsis. So sepsis has 4 levels. There's SIRS, which is the systemic inflammatory response syndrome. And the thing about SIRS is you don't have to have an infectious response. Most people think, oh my gosh, sepsis, you have to have an infectious process. We don't have to have an infectious process with SIRS. We can see SIRS in traumas because it's where the body just kind of goes haywire and says, ooh, no, I don't like this, and I don't know what to do. I'm just going to go kooky. Okay, we see the tachypnea, the tachycardia, hypothermia, or fever. It's really a group of signs and symptoms that we see in a patient. When we have sepsis is when we have SIRS in response to an infectious process going on in the body. So somewhere in there, there's some type of an infectious process, and we develop SIRS due to that. Then we have severe sepsis, and severe sepsis is where you have the sepsis, but you have organ dysfunction due to the sepsis. It is attributed to that sepsis, all right? Then septic shock is where we have organ dysfunction and organ failure in a particular system, which is what? The cardiovascular system, all right? So those are the things that you need to remember. There's one other little piece of information I want to give you, that you may see a physician do a lot of documenting of bacteremia, and that's kind of an old way of describing sepsis and documenting sepsis. However, per Coding Clinic, 2000, second quarter, pages 5 and 6, I quote, "Bacteremia is bacteria in the blood as confirmed by culture," end quote. So what that's telling you is that bacteremia is really just a laboratory finding, whereas septicemia is an actual illness, or sepsis is an actual illness. So you can't just code sepsis based on a documentation by the physician of bacteremia. All right, that would be one that you would want to query. Okay. So when we're coding sepsis, we are going to need to assign a code for whatever that underlying systemic infection is, okay? So then if a physician, let's say a physician documents urosepsis, what are you going to do? You have to query the physician for clarification on that. What does he mean by urosepsis? Does he mean that there's just a urinary tract infection, or does he mean that there was a urinary tract infection that has gone systemic to sepsis? So that's one, that would be an instance where you would need to query the physician. All right. Let's say a patient has organ dysfunction and sepsis, but that sepsis is not tied to the organ dysfunction or linked to it by the physician's documentation. If that is the case and you can find no other cause for that organ dysfunction, then you need to query the physician for clarification. You know, what is the clinical significance of the organ dysfunction and the, you know, the sepsis? Find out from the physician. If you can't find any other cause, then chances are it's due to that sepsis, right? All right. If that organ dysfunction is linked, then you will code severe sepsis, not just sepsis. All right. Let's see. Moving on. So sequencing. So sequencing can get a little, touchy, but if you look in your book on page 193 at the little green boxes, I would make note of that area because it's going to follow you right through. It's going to help you go step by step. So when you're sequencing sepsis with a local infection, such as cellulitis, the first thing you're going to do is you're going to code the underlying system infection. All right, so you'd code that sepsis piece. That's the biggie, right? Then you're going to code the localized infection. So then you would code the cellulitis. So if you have cellulitis of the hand that has gone septic, you're going to code the sepsis, and then you're going to code that cellulitis of the hand. If you have severe sepsis, you will code it if you have it, and if you do, you will code any applicable organ dysfunction that you may see, if you have any, and if the physician has linked it. So let's say then you're coding for a sepsis due to a post-procedural infection. So patient goes in, has surgery, they come out, they develop, let's say they develop an infection at the incision site, and it becomes septic. So the first thing you're going to code is a post-procedural infection. You're going to code that first, okay? That will be first. Then you're going to code any specific infection that they have. So what is that specific infection? It is, you know, of the incision site. What kind of infection is it? Then you'll code severe sepsis if they have it, and any applicable acute organ dysfunction. It's pretty simple stuff, really, when you think about it, and this will help you tremendously. All right. So let's say you have sepsis that's due to a non-infectious process. So the first thing you're going to do is code that non-infectious condition. What is the condition? And then you're going to code that resulting infection. Then you're going to code any applicable organ dysfunction, and you do not assign a code of SIRS for a non-infectious origin. You just do not put a SIRS code on. So if we look at the example in your book, it says a patient admitted with pneumonia, fever, and tachycardia. Physician suspects sepsis and orders blood cultures. 2 days after admittance, cultures are positive for pneumococcal bacteria, and the physician confirms pneumococcal sepsis. The codes are A40.3 and J18.9. That's it. That's it. All right. So that's sepsis. The biggest thing that you can do to help yourself is to really keep an eye on that section of your book where it has the green boxes. Just follow that. That will keep you going. It'll kind of hold your hand as you're sequencing those things. Maybe put those on a flashcard. Maybe put them in Quizlet. All right. If you have any questions, let me know.